The Senator from Northern Fairfax, Senator Howell.
Return to the morning hour for the purposes of a point of personal privilege.
Senator has the floor.
Thank you, Mr. President. Yesterday afternoon, I received a letter from His Excellency, the Governor. It was addressed to the budget conferees. It was about Medicaid expansion and his opposition to Medicaid expansion, his concerns about it. I wasn't surprised by what I read because it was what he's been saying for quite some time. But as I got to the end of his letter, there was a phrase that greatly troubled me. And then, very soon thereafter, I think we all got a press release, and in it was that same phrase. And I started thinking about it, and the phrase was, the immoral national debt. Now, we don't talk very much about morality here on the floor of the Senate, but I started thinking about some moral issues. And I said to myself, isn't it immoral to deprive 400,000 Virginians, our neighbors, of medical insurance? And then I thought, well, isn't it immoral to deprive 30,000 Virginians, our neighbors, of good-paying jobs? And then, isn't it immoral to send the hard-earned money of tax-paying Virginians that should be coming here to other states? Well, I had gotten about that far in my thinking when I received an email from a doctor at the University of Virginia. And I would like to read it. I don't know how many of people received it, but it really touched me. He wrote, I'm a pro-life family physician who regularly cares for patients covered by Medicaid and many who lack health care. There are many good policy reasons to approve Medicaid expansion, which are outlined below, and of which I'm sure you're aware. I want to add a human reason to this. Patients I have cared for die every year in the Commonwealth of Virginia because they do not have health insurance. Many of these patients have access to insurance, would have access to insurance through a Medicaid expansion, and lives will be saved. One such patient is a woman who my nurse practitioner consulted with me about 2 weeks ago. This woman is 54 years old, works a full-time job, but lacks health insurance. She would qualify for Medicaid under the expansion. Unfortunately, it will be too late for her. She noticed a lump in her breast last year, put off coming to the doctor's office because she was worried about the cost of care, and by the time she finally came in, we found a breast cancer that had already spread throughout her body. She will die from this breast cancer. If she had had insurance and had regular access to mammograms, her death from breast cancer could have been prevented. And so I ask you, is it not immoral to have Virginians die for lack of health care? Thank you, Mr. President.